Hello again, everyone. Welcome to our Writing the E&M Highway TCM review with interactive Q&A webinar. My name is Ashley DeCoto, and I am a specialist with our provider outreach and education team. On the call with me today is my friend and colleague, Leanne Foster, who will be helping out with the chat. I have just a few reminders for everyone before we get started. This webinar is part 2 of our 2-part series on Transitional Care Management, or TCM services. Yesterday, Leanne held the part 1 webinar, which provided more of a comprehensive overview on TCM. Now, if you were not able to attend that session yesterday, the recording will be available within the next week or so, both in the training center of our website and also on our YouTube channel. We will also have a recording of this session available in the training center on our website, and Leanne will be adding a link for the training center to the chat. And it will be out there on our website for the next 60 to 90 days, barring any technical issues with the recording. And you can actually access this without having to access YouTube, as we do recognize that not everyone is able to access YouTube from work. The recording will also be out on our YouTube channel, and it will stay there as long as the information remains relevant and current. Also, a copy of the presentation will be emailed to all attendees following today's event. We are taking questions through the chat today, which again, Leanne will be monitoring. I will check in with Leanne at the end of the presentation, time permitting, for any unanswered questions in the chat. We did have quite a few questions that were pre-submitted with registration, and I will be answering those that relate to TCM throughout the presentation today. Now, if we do not get to live chat questions, or if we have more questions than time allows for, we will answer those in a follow-up email. All right, for our agenda today, we'll start out by doing a brief recap from Leanne's part 1 webinar yesterday, where again, she went into more detail on TCM services, including the elements of TCM and correct billing. Again, if you were not able to attend that, we encourage you to review the recording, either from the training center on our website or from our YouTube channel once those become available. After that, I will share some claims data for TCM. We received a few pre-submitted questions asking for updates, and at this time, there have not been any recent changes to TCM, so I don't really have any new updates to share outside of the recent claims data that I will be sharing. After that claims data, the remainder of our webinar will be the interactive Q&A activity. Also, I did want to mention I've included some resources in the presentation, and I will be going out to show you at least one of those. And these may be resources that you saw yesterday if you attended Leanne's part 1 session, but we really want to make sure you know where these are for today's activity. All right, Leanne, could you confirm that you could see my screen again? I'm so sorry, I don't know what happened there.
We can see your screen, Ashley. You're all set.
All right, good, thank you. All right, so let's move into our review of Leanne's session from yesterday. All right, so for a review for Leanne's session, Transitional Care Management, or TCM, is a 30-day service which helps patients transition from an inpatient setting back into their community setting and allows for patient care coordination. And the overall goal of TCM is to reduce the number of subsequent readmissions to an inpatient facility by providing patients and their caregivers with the knowledge and the tools to manage healthcare concerns before they escalate. So these services help ensure that the patient is not left waiting for appointments for months after discharge, and it addresses concerns within a short time frame from the discharge. TCM helps to eliminate those gaps in care for the patient transitioning from a facility to the home setting. So these services really serve as kind of a preventive service to help keep the patient on track. Patients in facilities can really have a lot going on with discharge, like medication changes, advice, and care plans from multiple practitioners. TCM allows the billing provider to evaluate all the patient information and coordinate care moving forward. So one part of TCM is the coordination of care with other practitioners. When providing and billing for TCM, we like to think of it as you becoming kind of the coach for that month. You may not be treating everything that is going on with a patient, but you are coordinating that care so everyone is on the same page and the patient has one practitioner that knows what is going on with others and is coordinating the care plan. So TCM is billed using one of two codes, which are listed here on this slide. 99495 requires a face-to-face visit within 14 days from discharge and at least a moderate level of medical decision-making during the service period. 99496 requires a face-to-face visit within 7 days and a high level of medical decision-making during the service period. Leanne and I did several series on medical decision-making over the last few months. So if you're looking for more information about medical decision-making, I do highly encourage you to check out those videos on our YouTube channel, and those will be in the Evaluation and Management Services playlist. So both of these codes require contact with the patient or their caregiver within 2 business days of discharge. And this contact can be done by phone, by email, or face-to-face, and the contact can be completed by the practitioner or by clinical staff. This contact is where you would review the discharge summary, assess the patient's post-discharge clinical status, review symptoms, and address any questions the patient might have. You must also complete any medication reconciliation before the required face-to-face. And this is something that could be done or at least started during that interactive contact with the patient within 2 days from discharge. We did have a question asking if the provider needs to document in the note that the discharge summary was reviewed. And the answer to that is really yes. This will be part of the transitional care management process. There needs to be a review of the discharge summary and then updates made to the patient's medical record to incorporate any changes needed to the plan of care based on that review. So that review will be really important in determining the plan of care for transitional care management. For example, maybe you have a primary care physician who will be providing and billing for transitional care management, let's say for an established patient who was just discharged from an inpatient hospital stay. Let's say this patient is an 85-year-old woman who was maybe briefly hospitalized due to a urinary tract infection. She was prescribed a 10-day course of oral antibiotics and advised to use a temporary walker due to weakness. Now, these things are important for the physician or practitioner who is providing TCM to review and incorporate that into that patient's plan of care. All right, next we've included some claims data for care management. And we had very limited claims data for TCM services, as these appear to be very underutilized services. And to give you kind of an idea for comparison, we had almost 600,000 claims for chronic care management in the last 6 months, compared to only about 87,000 for TCM services. And that's for both of our WPS jurisdictions. Over the next couple slides, I will be sharing what our top denials and rejections have been for all types of care management services to kind of give you an idea of what to look out for if you are billing or maybe decide to start providing and billing for TCM services. All right, so here we have the top claim denials we see for care management services. Our biggest denial is payment already made for same or similar procedure. So if you've already billed care management this month, you'll receive this denial if you bill a second time. This could also happen if more than one provider tries to bill TCM in a single 30-day period. And same thing applies for other care management services. They may only be billed by one provider. The next top denial is for the patient being enrolled in hospice. So for patients in hospice, all care related to that terminal hospice diagnosis is included in the hospice care. For services not related to the hospice diagnosis, you will want to bill with the appropriate modifier. Then last for our denials, we have units of service exceeded. TCM would only be billed with one unit of service, and if you bill more than one unit of service, you would receive this type of denial. And we see this type of denial more with CCM and PCM, which have time-based codes, including codes to bill, bill for each additional 30 minutes. So if billing those and exceeding the CMS maximum allowed amounts, or the MUEs, these amounts could cause this type of denial. But for TCM, again, if you bill more than one unit of service, for example, maybe you entered 11 units instead of one by mistake, you would see this type of denial. All right, and here we have the top rejections for care management services. Our top rejection is clinic number missing or not entered accurately. So for these, you want to make sure that you've included your clinic's NPI and that it is entered correctly. If you omitted the NPI or maybe you keyed it incorrectly, you would just want to make that correction and then resubmit your claim. Next, we have incomplete or invalid modifier. So you might see this type of rejection if you report a modifier that is not applicable to care management, such as maybe a surgery modifier or a bilateral modifier. Since these types of modifiers do not apply to care management services, appending them could cause your claim to reject this way. The last rejection we have here is for missing, incomplete, or invalid provider identifier. These rejections happen if you're missing or include inaccurate information to identify your provider or facility. So this could be including the rendering provider's ID number, which is your provider's NPI. It could be an invalid or missing tax ID number or your facility location. If your claim rejects for missing this information, or maybe the information submitted was invalid, you would fill in that missing information or correct any errors and then resubmit your claim. So I've included this slide here as a reference to help summarize what I just talked about for care management denials and rejections. For your rejections, you'll want to fix the error and resubmit the claim. Keep in mind that for rejections, the claim was not able to fully process, meaning a claim determination was not yet made, and the claim does not have appeal rights. Those must be corrected and resubmitted. Then for your denials, your next step will depend on the type of denial you receive, and your remittance advice will really be your best source to determine what's next. It may indicate that you need to resubmit your claim, in which case you can correct the error and resubmit. And then in some cases, you may be able to correct a minor error through a clerical error reopening using our SecureNet Access portal. So this might be a keying error for your place of service or your rendering provider's NPI, for example. And then you will have denials that will require you to appeal if you disagree with the claim determination. And your remittance advice would include remark code MA01, which indicates that you have appeal rights. Lastly, there is a link for the last bullet on this slide, which has some information on how to appeal a claim. All right, now we're going to shift gears into our interactive Q&A activity. And we've designed this to be kind of a fun way to test your knowledge on TCM. We will be launching a poll for each question during this activity. And even if you aren't 100% sure on the correct answer, we'd love for you to participate and give it your best shot. I'll give you a moment to lock in your answers, and then I'll walk through the correct answer for each question. Now, in case you're new to these Q&A activities, I do want to explain how to use our webinar software for the activity. We will be using Slido within WebEx to launch each question. To find Slido, you will need to click an icon with a plus sign. It should be down next to the chat icon towards the lower right of your screen. And it would say something like Show Apps or Show Apps Panel if you hover over it. Once you click on that button, it should allow for you to click on Slido, which again is the platform that I'm going to be using to launch these questions. All right, before I launch the first question, we did have a few pre-submitted questions asking for resources. This slide has resources that can be used for our activity, and Leanne will also be placing these links in the chat. And you're welcome to have these open to help out with our activity. The first one listed here is one that I find particularly helpful, and that's the Transitional Care Management MLN. Also, the second link is to an FAQ, kind of a hidden gem, and there's definitely some information in there that will help with some of our questions. Okay, for our first question, we're going to start out a little on the easier slide to give everyone a chance to find Slido. So this question is, TCM is a 60-day service following discharge from an inpatient stay. True or false? All right, I think most of you have your answers in. The answer to this one is false. TCM is a 30-day service beginning the day of discharge from a facility stay and continues on for the next 29 days. All right, let's move on now. So for our second question, who can bill Medicare for TCM services? And you can select all that apply. Is it A, clinical staff, B, non-physician practitioners, C, physicians, or is it D, nobody? TCM is not covered by Medicare. All right, the answer for this one is B and C. TCM can be billed by physicians and by non-physician practitioners, such as nurse practitioners and physician assistants. So CMS does not limit TCM services to any one specialty, but expects that the physician or practitioner billing TCM will end up having an ongoing relationship with the patient. The only note that CMS has made as far as specialty is concerned is that this wouldn't typically be provided by surgeons, as they would not be in a position to coordinate all aspects of the patient's care because their relationship with the patient frequently ends after the global period. So while TCM services might typically be reported by primary care physicians, CMS again has not established any restrictions for specialties on who can bill TCM. We had a pre-submitted question which asked, what type of facilities can render transitional care management? Well, TCM services can be provided in any outpatient setting where eligible practitioners would normally furnish services. So it could be physician's office, a hospital outpatient department, rural health clinics, and federally qualified health centers. All right, we'll move on to our next question now. So for this question, TCM only includes face-to-face services, true or false? All right, I think most everyone has their answers in. The answer for this one is false. TCM services will include non-face-to-face services that may include things like reviewing discharge information, interacting with other healthcare professionals to coordinate care, educating the patient or their caregiver, and helping the patient access any needed care. Now, the only element of TCM that must be done face-to-face is that required visit within 7 or 14 days from discharge. We had a pre-submitted question which asked, TCM criteria is met, including moderate medical decision-making, but no follow-up appointment for 6 months. Can TCM be charged? And the answer to that is, it could be if the requirements are met. And there must be documentation of first the interactive contact within 2 days. Also, medication reconciliation must be done on or before the day of the face-to-face visit. Then there's not a requirement for any additional face-to-face visits during the TCM service period. So in your situation, you may be able to bill TCM. Most TCM services are provided non-face-to-face. So are you obtaining and reviewing the discharge summary and reviewing any diagnostic tests and treatment? Have you assessed the patient's health status, medical needs, and psychosocial needs following the discharge and providing the patient any needed education? Have you assisted the patient in establishing any needed home and community-based resources and coordinated care with other providers that might be involved in that patient's care? Those are services that will be provided typically in a non-face-to-face setting. So even though you won't see the patient face-to-face, hypothetically for another 6 months, you can still bill TCM if the requirements are met and the patient receives the clinically appropriate non-face-to-face services. Okay, moving right along. Our next question is, TCM billed with 99495 requires a face-to-face visit within how many days from discharge? Is it A, 2 days, B, 7 days, C, 14 days, or D, 29 days? I'll give it just another minute. Okay. The answer for this one is 14 days. I want to open up one of the resources that you have in the chat for this activity, which will be the Transitional Care Management MLN booklet, or the first link in your list. So here's the MLN booklet, which is really the main source of information for TCM services. If we scroll down to the second page, we'll see a table of contents. And here you can click on the title of any section and it will take you to that part of this booklet. So I'm going to click on TCM components. And that section begins here on the bottom of page 4. So here you have information on the interactive contact required for TCM. Then if I scroll down a little to the next page, we have examples of non-face-to-face TCM services for physicians and non-physician practitioners, as well as for auxiliary personnel. Now, for the answer to this question, the top of page 6 lists both of the TCM codes along with the official code descriptors. So it tells us here that code 99495 requires a face-to-face visit within 14 days from discharge and at least moderate medical decision-making. Just below that, we see the other code, 99496, which requires the face-to-face visit within 7 days of discharge and requires high level of medical decision-making during the service period. You will not bill a separate E&M visit for the TCM required face-to-face visit. That visit for TCM will help you in determining which of these codes to bill for TCM, and the date of that visit is going to be your date of service. All right, I'm going to head back on over to the presentation and on to our next question. So for the next question, we have a scenario. Betty is discharged today from a skilled nursing facility and is going to an assisted living facility. Which of the following are true? Is it A, Betty is not eligible for TCM services? B, Betty is eligible for TCM services if she has a face-to-face visit within 3 days of discharge? C, TCM is only for inpatient hospital discharge? Or D, Betty is eligible for TCM services if she has a face-to-face visit within 14 days of discharge? I'm going to give it just another moment. I think a few are still working on getting their answers in. Okay, so the answer for this one is D. Betty is eligible for TCM services if she has a face-to-face visit within 14 days of discharge. Leanne spoke yesterday about the eligible facility stays that a patient could be discharged from. And this can include an inpatient hospital, a hospital outpatient observation, a partial hospitalization, or a skilled nursing facility. Then the patient can be discharged from any of these stays back into their community, which could include being discharged home or to a group home, to a nursing facility, or in Betty's case, discharged to an assisted living facility. We had a question which asked if there should be a discharge code 99238 or 99239 billed in order to provide a TCM service. And no, that's not a requirement. The provider who is providing the TCM services does not need to be the provider who discharged the patient. And for the codes mentioned in this question, 99238 and 99239, these are hospital inpatient or observation discharge day management codes. Just keep in mind, TCM is not limited to just discharge from a hospital. The patient could also be discharging from a skilled nursing facility. In either case, though, there's not a requirement for discharge codes to be billed in order for a provider to bill TCM services. Okay, next up. The face-to-face visit required for TCM may be done via telehealth. True or false? All right, just about everyone got their answers in pretty quickly, and I think we're kind of split down the middle, and a couple of you aren't sure, and that's perfectly fine. The answer for this one is true. So this is noted in that same MLN that I had pulled up earlier, which tells us that you can provide the face-to-face visit for TCM via telehealth. There are a limited number of services that Medicare will cover if done via telehealth, and those are on the CMS list of telehealth services. Both of the TCM codes, 99495 and 99496, are on that list. We had another pre-submitted question, which asked if TCM and an office visit can be billed on the same date for the same provider and same visit. And the answer to that is no. You would only bill the TCM code for the date of the face-to-face visit. You cannot bill both the TCM and an E&M office visit code on the same day. All right. So next up, which of the following are true about 99496? And you can select all that apply from these options. Is it A, requires a face-to-face visit within 2 days? B, requires a face-to-face visit within 7 days? C, requires high level of medical decision-making during the service period? Or D, requires communication with the patient within 2 business days of discharge? Okay. The answer for this one is B, C, and D. So hopefully some of you use that MLN to find the answer. 99496 requires a face-to-face visit within 7 days of discharge, a high level of medical decision-making, and contact with the patient within 2 days of discharge. The interactive contact within 2 days. Keep in mind, this cannot just be an appointment reminder. It must be an interactive exchange to follow up on the patient's post-discharge status and any symptoms, medication needs, or clinical questions they may have. Now, if you're unsuccessful in making this contact, the attempts will need to be documented, and you should continue trying to contact the patient and document any future attempts. Now, if the required face-to-face visit is not done, then TCM cannot be billed at all. Belinda pre-submitted a question with registration, which asked, does utilizing my chart with the patient count as the interactive contact within the 48 hours after discharge? And this is a really great question, I think. And the answer to that is yes, but only if the requirements are met. So this must be an interactive contact, and it must be, again, more than just confirming an appointment. So if you have that dialogue going back and forth with the patient, addressing their post-discharge status and any needs beyond scheduling that follow-up appointment, this can count. If this is just confirming or scheduling the follow-up appointment, then this would not count. Another pre-submitted question asked, do you have to have a patient contact in order to bill, or can a provider see them next day without the phone call? So the interactive contact can be done by phone, it can be done electronically, or it can be done face-to-face. So if the provider has the face-to-face visit within 2 days, then there's really not a need for a separate phone call because they've met the requirement for both the 7 or 14-day visit and interactive contact within 2 days. Okay, next. All right, for our next question. Which of these are examples of TCM services that auxiliary personnel may provide under general supervision? And you can select all that apply. Is it A, provide required face-to-face within 7 or 14 days? B, assess and support treatment adherence, including medication management? C, help patient access needed care and services? Or D, communicate with the patient? I think just a few are still getting their answers in. Okay, the answer for this question is B, C, and D. So auxiliary personnel may provide a number of non-face-to-face services for TCM under the general supervision of the billing practitioner. They can communicate with the patient and with other agencies and community service providers that the patient uses. They can assess the patient's treatment adherence, such as their adherence to taking medications. They can help the patient access any needed healthcare services and provide education to the patient on self-management, independent living, and activities of daily living. The billing practitioner, however, must complete the required face-to-face visit within 7 or 14 days. Okay. Next up, the date of service for TCM is the date of discharge, true or false? All right, I think most of you have your answer in. It looks like we're a little split on this one. The answer for this one is false. The date of the TCM required 7 or 14-day face-to-face will be your date of service. So you would build the appropriate TCM code, 99495 or 99496, and use the date that that face-to-face visit occurred as your date of service. Okay. Next up, so for this question, we have a scenario. Bobby was inpatient at ABC Hospital and treated by cardiologist Dr. Sue and primary care physician Dr. Hank. Bobby was discharged on 8/14. Which of these are true? Is it A, both Dr. Sue and Dr. Hank can bill TCM? Dr. Sue is not eligible to bill TCM services. C, the TCM date of service is 8/14. Or is it D, either Dr. Sue or Dr. Hank can bill TCM, but not both? Okay, so the answer for this one is D. Either doctor could bill TCM since there's not a restriction on specialty. So either cardiologist Dr. Sue or primary care physician Dr. Hank could bill for TCM if the requirements are met, but not both of them. Their date of service will be the date they complete the required face-to-face visit. We had a pre-submitted question which asked about TCM billing when multiple providers see the patient after discharge. So this could be like our situation for this question. Maybe both Dr. Sue and Dr. Hank have follow-up appointments with Bobby. Only one of them is able to bill TCM services. So it may be a good practice to communicate with the patient that only one provider can bill this service. Also, keeping in mind that care coordination is part of TCM services, that communication may be from auxiliary staff in coordinating with other providers involved in the patient's care. So if, let's say, Dr. Hank is providing TCM services, the auxiliary staff may be in communication with Dr. Sue's office, and this information can be shared. So in this scenario, Dr. Hank would bill TCM using the date he saw Bobby for the required face-to-face. Dr. Sue could not also bill for TCM, but can absolutely bill for any medically necessary follow-up E&M visits. Okay, on to the next question. We have just a few left. There we go. So for this question, E&M services may be billed separately during the TCM service period. True or false? Okay, the answer for this one is true. Your TCM services will be mostly non-face-to-face services with the exception of the required face-to-face. Now, the required face-to-face within 7 or 14 days is not billed separately. It is included in the TCM services. So you would not bill both 99495, for example, and an office visit like a 99214. You would just bill 99495 if you had the visit within 14 days and moderate medical decision making during the service period. But for any additional E&M services during that period, you can bill those separately. All right, moving on to our next question. So for this question, TCM services may be billed in the same month as which of the following? You can select all that apply. Is it A, chronic care management, B, advanced primary care management, C, during a global surgery period for a surgeon that's billing TCM, or D, E&M services? I'll give it just another moment, give everyone a chance to get their answers in. Okay, the answer for this one is A and D, chronic care management and E&M services. Rose asked a great question with registration, which said, what are other things you can bill with TCM? I am going to open back up that MLN for transitional care management and show you where you can find this information. So I'm back in that MLN, and we left off here on page 6. I am going to scroll down a little bit on this page, and you can see this section on TCM concurrent billing. This chart lists all the codes that can be billed concurrently with TCM services, and there's a lot here. So there are ESRD services, remote monitoring, chronic care management, and so on. Now, below that chart on page 13, type that up here, there are some billing tips. There's a couple things I want to point out in this section. First, it tells us in here that you can report any reasonable and necessary E&M services during the TCM service period, except for the required face-to-face. This section also tells us that a surgeon would not bill TCM during a global surgery period. So what does that mean? Well, let's say you have an orthopedic surgeon who performs a hip replacement and they're not able, so they wouldn't be able to bill TCM services if the TCM period falls within the global period for that procedure. But a primary care physician may bill TCM if they did not perform the surgery. All right, I'm going to head back over to the presentation. So we found out in that list and in the billing tips section that you can bill chronic care management and E&M services during a TCM service period. We also saw that you cannot bill for TCM services during a global period if your provider performed the surgery. That leaves answer B. So advanced primary care management, or APCM, this is a bundled care management service that includes transitional care management, as well as principal care management and chronic care management. So if you are billing for APCM services, you cannot bill TCM services separately. It's included in the payment for APCM. Leanne and I actually did a series last month on APCM, and if you were not able to attend, I encourage you to check out the recordings of that series on our YouTube channel. All right, we have just a couple more questions left. It's taken me just a minute to get this one to load. Here we go. So on this question, we have another scenario. Sam is discharged from ABC Hospital on 8/1. Dr. Foster provides the required TCM face-to-face in her office on 8/5. Which of the following are true? Is it A, Dr. Foster can bill TCM with place of service 11 and date of service 8/1? Dr. Foster can bill TCM with place of service 21 and date of service 8/1? We have C, Dr. Foster can bill TCM with place of service 11 and date of service 8/5. Or is it D, Dr. Foster can bill TCM with place of service 21 and date of service 8/5? All right, the answer for this one is C. Dr. Foster will bill the appropriate TCM code 99495 or 99496, depending on whether SAM required moderate or high medical decision making. And she will use place of service 11 for her office where the face-to-face visit took place, with date of service 8/5, which was the date of the face-to-face visit. So you'll use wherever the face-to-face visit took place as your place of service and the date of that visit as your date of service on the claim. We had a few pre-submitted questions asking what the documentation requirements are for TCM. You'll want to document what services were provided as part of TCM and who provided the services. But the documentation at the very least must include the patient's discharge date, the date and details of the 2-day interactive contact, the face-to-face visit date, and documentation to support either moderate or high medical decision-making, depending on which code you're billing. Another question asked, where does the date of discharge have to appear? The call or the provider's documentation? So CMS does not mandate where this is documented, just that it is required to be documented in the medical record for TCM services. So either way would be fine. It could be noted in the interactive contact or included in the provider's notes from the face-to-face visit. All right, the last question. I can get that to load. There we go. All right, the last one. Medication reconciliation must be performed on or before the face-to-face visit date. True or false? I see a few people selected answer D. Is it Friday yet? I second that. All right. The answer for this one is true. You must provide medication reconciliation on or before the face-to-face date. So maybe this is happening during that interactive contact within 2 days of discharge. Your clinical staff is speaking with the patient, asking how they're feeling, if they have any symptoms, and ask what medications they are taking. Were there new medications prescribed during the inpatient stay? Were they taking any medications prior to the inpatient stay? And are there any duplications? Is the patient taking them as prescribed? That information should be documented, and this needs to happen again on or before the day of the required face-to-face visit. We received one last question, which asked, does dose and frequency need to be documented to count as med reconcile? And yes, that would be standard to review and document the dosage and frequency as part of the medication reconciliation. Okay, and I know we are just about out of time, but I do want to check in with Leanne to see if we have any unanswered questions in the chat that we might squeeze in.
Ashley, we do not have any unanswered questions in the chat.
All right, perfect. Thank you. I know she was working away with lots.
Ashley, we lost your audio. You might be on mute.
I sure am. I was just going on and on about how much I appreciate you answering all the questions in the chat. We're doing
Well, you're welcome.
If you do think of any additional questions, you have 7 days from today to submit those. You'll send those to our education mailbox and make sure to include the title of the webinar, Writing the E&M Highway TCM Review with Interactive Q&A in the subject line, or you could just shorten that up to TCM Activity Webinar or something like that. And that will make sure that those emails come to Leanne and I. Please keep in mind that we are not able to access any claims history, so you will want to contact customer service for any claims related questions. In a few minutes, we will send out an email to thank you for attending, and make sure not to delete this one without reading it. This will contain your certificate of achievement. So it has your name and contact hours if you need that to turn it in towards, or for credit towards continuing education units. Now, if you do not receive the email, a couple of things may have happened. First, you might want to check your spam or junk folder. Also, if you joined by phone only, you would not have received this email, as there's not a way for us to capture your email systematically from the attendance record. But no need to worry if that's the case. You are able to email us with the phone number you joined with to request your certificate of attendance if you need that. And Leanne will be adding that email address to the chat. All right, one last thing. I know we are a minute over time. Please take a few minutes to complete the survey. You can tell us what you like and suggest topics for future education. You have a few different options to take the survey. You can use the link that Leanne just placed in the chat, or when you exit today, you'll be prompted to go to an external site, and that external site is the CMS Qualtrics page. You'll have a prompt that'll look kind of like the picture we have shown here with the little yellow triangle. And for those listening through our website or through YouTube, you'll have the same opportunity to provide feedback. You will have a survey card at the end of the presentation, and there's also a link available in the description. All right, it looks like we made it. Thank you everyone so much. On behalf of myself, Leanne, and all of our provider outreach and education team, we thank you for taking the time to join us. We appreciate you joining us for the Q&A activity, and we look forward to your survey feedback. Everyone have a great afternoon. You may now disconnect.